Hello and welcome to Rolling Pulse, brought to you by Rolling Books. I am Chirag Thakkar, and this is our special series of conversations on mental health in India in association with the Health Collective. Part of today's conversation on India and mental health and why you need to care about it are Kamna Chibbar in conversation with Jagrati Chandra. Kamna Chibbar is a clinical psychologist and head of the Department of Mental Health and Behavioral Sciences at Fortis Hospital and a frequent contributor and advisor for the Health Collective. Jagrati Chandra is a journalist with The Hindu who covers and writes on issues to do with mental health among other areas and is also part of the network of women in media in India. I'm very pleased to welcome Kamna and Jagrati to this discussion. Jagrati, why don't you get us started?
Thanks, Chirag. Hello, everyone. We are bringing you this conversation as part of a collaboration between Rolly Pulse and Health Collective. As some of you already know, Rolly Pulse is a digital initiative of Rolly Books. Hi, Kamna.
Hi, Jagrati. It's a pleasure to be on the platform.
Thanks, Kamna. Let me get started straight away. I want to ask you that today, when we are having this interaction, we are doing this 3 months into the lockdown, and we are right in the middle of a global health crisis. But at the same time, there have been a lot of conversations around mental health. There have been a lot of webinars on mental health. Do you think, the subject has become a topic of dinner table conversations, or is there still a lot more that needs to be done?
Working in the field of mental health now for more than a decade, I think any conversation that happens is so important. It brings mental health to the forefront. And I think this entire situation in which we've been in this lockdown during this pandemic, the numerous platforms across which mental health has been spoken of, it's very, very valuable. But at the same time, I also know for a fact that there have been many times when we have reached a point where mental health has taken center stage. And then somewhere conversations around it, the discourse around it just tends to kind of, die down. And this is something which has happened time and again. And even though today everyone may be talking about and wondering about how do they take care of their health, their well-being, they're looking at beyond regular exercise and diet, and they're talking about what can they do to maintain their thought process, their feeling states, how do they stay more positive and optimistic, and how do they ensure that somewhere their moods are not getting affected, their anxieties are not becoming overpowering for them. I think it's very, very valuable, but what's most essential is that this discourse needs to keep continuing. It cannot become another little crest which has come up and then it just kind of moves away and we all forget about it. So I think that's something which is very, very important as well at this time.
Okay. I also wanted to get a sense of, what your experience has been in the past 3 months. Are you getting a lot more inquiries? Are a lot more number of people getting in touch with you to seek help? And what are their worries about? And what happens to those people who already had illnesses before COVID-19?
So it's a very loaded question to start with, because I think it has so many components to it. If you were to ask me that as a clinician, as someone who's practicing in the field, currently do I individually get a lot many more people reaching out for mental health support during this time? Then the answer is yes, that is very much there. There are a lot of people for whom mental health concerns have suddenly become a top priority, and they have become very much prominently placed in their life. For a lot of individuals, what typically happens is that when you're going through the cycles of your life, when you're moving between your work, your home, you don't have that kind of time to be able to even reflect and introspect on what may be happening around you, what may be a bother or a concern, and mental health would always get neglected. Suddenly people are in situations where, one, they also have the time to be able to reflect on these things, but they're also in the midst of situations where they just can't ignore them. So if people had, say, relationship related difficulties, right, or they had jobs which were in any case full of a lot of uncertainty and unpredictability, all of those issues have just come very, very prominently out there for them. And so that has certainly made people realize that they need to address their own mechanisms of coping with situations, how they're viewing things, how they're perceiving them, how do they understand them, what is it that they can do to take care of their own selves, how do they create support systems to be able to effectively navigate through this entire space that they're finding themselves in. So I think that's one part of the question that you're asking me. I think the second part also is that besides being a clinician, I also work within a department. And one of the things that we do is we run a helpline. And what we have seen in these last 3 months is that the average number of calls that we would receive on our helpline, which is a 24/7 helpline available, in 15 national languages, the number of calls have just gone up substantially. And we're getting calls from all over the country. And in fact, we've been getting calls not just from India, we're also getting calls from outside the country. And I think somewhere there are a lot of people who have been facing a lot of struggles at this point in time. And if I were to try and break them down into what those components are, then I would say that, besides the fact that, there is a lot of anxiousness about what we're facing today, what is going on around us today, the kind of situations we are in, the uncertainty that we are finding around us, the unpredictability of when things are going to evolve and change. Would we soon be out of this lockdown? How long is this going to continue? So there is one part which is about that. There is another part where a lot of people are struggling with maintaining their moods and their optimism, the hopefulness, the resilience to be able to say that I can move through this. I think somewhere they're all struggling with that, because when you have a defined parameters to say that, okay, this is going to be here for a week, 2 weeks, a month, 2 months, your mind is mentally prepared. You have a sense of control. You know what you're looking at. Right now, because we don't have a structure or a framework within which we're working, it's becoming more and more difficult. And human beings in general struggle with unpredictability. We really struggle when things are more ambiguous. And, most of our actions a lot of times are directed towards finding a way to control the environment that we are in. That's how evolution has also happened. And now we're in a situation where that control has been just taken away from us. And so a lot of people are experiencing issues with that. Concurrently, I think for people who are living in larger family units, space is a bigger concern which emerges. A lot of them struggle to find time for their own selves. They have to look at fulfilling multiple roles. You may be sitting and on your laptop doing some work, and then suddenly you may be called into something which is going on in the house. You need to take care of something which would typically not happen. And so how do you keep on mentally and psychologically shifting in those roles, even though it's been 3 months and we have been doing this, is still a struggle. It's taxing, it's exhausting, and people can feel the fatigue just bearing down on them and experience the burden of it all, which is impacting moods. And by that, I mean not just feeling low or sad. There's increase in irritability, people snap more, there's a lot more frustration which is coming in, angry outbursts which happen. And then concurrently, what it leads to is a lot of relational conflict, whether it is between parents and children, between couples, if you're an adult, and even with your parents, if you're living with them, or if you've got in-laws, then with them, or, so there is conflict which has started emerging. And on top of that, you're feeling this intense pressure to ensure that you can hold on to your job. You don't want to become irrelevant or redundant. You don't want your organization to realize that they can do without you. So it's a lot that people are having to process. And I think somewhere a lot of struggle is emerging out of that also. So these are prominently the areas which do keep on coming up in front of us, which we've been trying to work with individuals in how they can develop the right skills and the tools to be able to navigate them.
Yeah, and the last part of the question was about people who were already suffering from mental illnesses before COVID-19.
I think there is a dual picture when you're looking at individuals who were already struggling with mental health illnesses. For some, yes, the challenges have increased, and the challenges have increased on account of the factors that I'm already mentioning, because they were already struggling with, say, their moods, anxieties, maybe relationship issues, maybe work-related challenges, and all of that has gotten exaggerated. And their coping resources are certainly getting far more taxed and it's very hard because suddenly you're also in a situation where you can't meet in person the experts that you've been working with. So suddenly you find that your support system has kind of, it's there, but you feel as though it's shrunk or it's not within your immediate grasp. So you could have scheduled an appointment and reached, the clinic of the individual that you were working with. Now you can't reach that clinic, and it took a while for people to be able to figure out getting into virtual consults and making sure that they're staying connected to their experts, virtually, and all of that. And that has certainly been helpful. So I think for people, this has been one part of the issue, which was a big challenge initially. But I would also say that for certain people who were also working on their pre-existing challenges, on their coping, on their strategies, on their relations, on how they think or perceive situations, or how they make meaning out of them, for some of them what has also happened is that this entire situation, they've been able to navigate it somewhat better compared to a lot of others, because they already had some tools available in their armor to be able to manage themselves and navigate the situation somewhat better. And in fact, this is something that I see with clients who've especially had difficulties with social situations. The fact that they suddenly don't have to navigate those spaces has made things a lot easier. They are far more productive, more easily able to manage their own selves, their own mental health, because they don't feel that pressure of having to be in the midst of large number of people, whether it was in their personal spaces or in their workspaces. So you have both parts getting highlighted in a way in this situation.
Okay. Kamna, you spoke of, the problem of access. And so I want to ask you a related question. When you talk about mental health services versus other kind of medical services, do you think access issues are far more complicated when it comes to mental health services? Because then, it really starts with the individual and the people around that particular individual and their mental blocks because of the whole societal stigma and other reasons. So do you think the issue of access is far more complicated when we talk about mental health?
I absolutely would feel so, because I think again, there are multiple layers to this. It's like an onion. If you keep on peeling it, you'll find a lot many more layers which exist to this entire problem of access within mental health. You're absolutely right. One of the biggest challenges to access is not having people around you who can understand and support you when you do experience a mental health concern. Our levels of awareness and our levels of knowledge of knowing how you need to respond to someone if they are sharing their mental health related problems is very, very limited. Most people do not know what they should do or shouldn't do if they have someone near them who may be struggling with a mental health related problem. And I think that limits and restricts a lot of people from being able to reach out and say that they're experiencing a challenge, and then proactively looking at what can I do, or who is an expert that I can reach out to. Mental health in India, in any case, has not necessarily been prominently placed. And that is very, very evident if you look at our mental health budget. Right? Our health budget in itself is very meager, and that's been a point of debate in the recent in the recent weeks, ever since we've been in this entire pandemic. But the mental health budget is a very minuscule part of the overall health budget. It's only about, if I'm not incorrect, it's only about 0.06% of the healthcare budget. So that's the space within which we are operating, right? And that certainly restricts access in multiple ways. So what you're looking at is suddenly you don't have the right kind of services because you don't have enough number of experts who are available to be able to work with the number of people who may need support. And the number of people who need support, according to the latest survey, which was in 2015-16, is 13.7% of the population. That's a very large number. And at the same time, the number of experts that you have available, I think we have about 0.3 psychiatrists for every 100,000 people who have of the population. Internationally, world over, the number is 6.6. So we are lagging way behind. So access automatically gets restricted. And again, if you go back to the survey, according to the survey, only 10% of the people who need mental health services are actually receiving the right kind of help. So you're looking at about 90% of people who are not even getting mental health related services. So certainly access is an issue. So not only are we not talking, we're not sensitive, we also don't have experts, we also don't have mental health facilities, we don't have the right kind of rehabilitation centers or beds available to be able to hospitalize someone, because yes, there are some mental health related illnesses which would require a period of inpatient care as well, and we don't have all of that. And now, to top it all up, we are also a nation which for which a large proportion of the population would struggle with affordability. So yes, as a clinician, I would say that most of our experts, you have varying ranges in which people may charge for sessions, but at the end of the day, even if you charge the least amount, mental health is not an illness which gets resolved within a few weeks. It takes time. So you're going to be connected to your expert once a week, once in a few weeks, once in a month, for a longitudinal period of time. That is certainly taxing on the financial resources of individuals. Yes, people who want to and can prioritize it, they do prioritize it. Yes, there are helplines. Like I mentioned, we run a 24-hour helpline. It's free of cost. But how many people would you be able to cater to through all of that? Thus, another issue which comes into access is the even though we've talked about insurance within mental health services, the government has passed the bill for it as well. But is it really implemented? Are people actually being able to utilize that service? So if you look at the problem of access in mental health, it's getting stifled because of all of these multiple factors. It's not just one thing which is coming in play. It's so many different levels at which we need to operate and work to be able to alleviate and find a way to resolve this entire issue of access. And it is going to require a number of years of work. It's not going away anytime soon, but we need to start, and we need to start in a big way. And that's going to be the only solution.
So several problems when it comes to mental health services. But, one of the problems that I have grappled with is the issue of depiction of people suffering from mental illnesses in the popular media. This means that most people expect patients to be completely disoriented, unable to perform their day-to-day activities. But that is not necessarily the case with a lot of patients. Most have successful careers, they party, they fulfill their household responsibilities. So what, according to you, are some of the big you have encountered, and how would you counter them with facts?
So I think starting from, what you were suggesting, I think that's one of the biggest myths that surrounds mental health illnesses, that people believe that every individual who has a mental health related problem would be completely non-functional and would not be able to perform their roles. Or a lot of people assume actually that people who have mental health related illnesses are extremely violent people. What people don't realize is that actually it's a very, very small percentage of people, if you were to look at it, who actually can become aggressive. It's a very, very small part of all mental health related conditions. In fact, most mental health conditions range in severity from the mild going up to the severe, and your treatments tend to vary according to that. And it's an absolute myth to believe that every individual who has a mental health related problem cannot function. In fact, most of them function very effectively. In fact, a lot of people, you will not be able to even make out that they may be taking some sort of help or support for their mental health related problem. And each one of us, I'm quite sure, if we have been fortunate enough to be to have those kind of friendships and relationships in our life, would be very well aware of those people when they would have opened up, that you would be completely shocked that they had been taking any kind of help. And I think corresponding to that myth also comes in the fact that people believe that if your life is fine and you don't have any big concern or a big issue, or you've not experienced any significant loss, then why would you have a mental health related problem? That mental health related issues only happen if you're struggling with, say, finances, or if you're struggling with some health condition, or you've experienced loss, or you've had some sort of a grief, or your relationship is not doing well. What people don't realize, again, and this is a big myth, mental health related illnesses are biological in nature. They occur due to neurotransmitter imbalances, Yes, those imbalances can be triggered on account of environmental factors, on account of personality related variables or stressors within an individual's environment, no doubt. But that does not mean that a mental health related illness cannot occur spontaneously. So, and one of the biggest things which has helped, at least in recent times, for people to realize that a mental health illness can happen to anyone, and that any one of us is not going to be immune to developing a mental health illness, is when a lot of celebrities, a lot of sports persons have come forward and talked about their challenges that they have been experiencing, because suddenly people are made to realize that these people live these wonderful lives, larger than, their lives are larger than what any one of us could imagine. And if they are struggling, so it would mean something. And I think that's been really, really beneficial. Another myth is that people believe that children cannot have mental health related problems. Most people tend to attribute a child or an adolescent having any struggles as it being about their temperament, or it being about, them being not very cooperative, or it's just a phase. And I think that's a very big myth. It's very important to understand that children and adolescents can have the same kind of mental health concerns that an adult can. And in fact, childhood onset mental health illnesses, from our perspective, require far more urgent and immediate treatment, because if they get prolonged, you're looking at a much longer lifespan for a child or an adolescent, which means that they are more likely to have far many more episodes if you're not going to treat it at the right age. So it's very essential to recognize that. And it's also, and another myth that which I think is one of the other more important myths, is that people think that having a mental illness means that, there is some defect in your personality or your temperament, or it's a sign of weakness. Because we don't see it as an illness like any other physical illness, we associate it with a person's mind, and we do not realize that it could occur to anyone, because like I said, it's a biological illness. It could happen to any individual. It has nothing to do with an individual's strength of personality or character. And that's how we need to approach mental health related problems, so that people can be encouraged to seek help.
Okay. Kamna, when it comes to self-care as well as providing care to somebody who's not well, what I want to ask you, what are the 5 do's or must-have for those who are suffering from mental health, and 5 don'ts for care providers?
Okay. So I'll start with the 5 do's that you must have if you are someone who's struggling with a mental health related problem. I think the first most important aspect is that you must reach out to a professional, right? Do not look at any other information, any other aspect. Make sure you reach an expert, and keep consulting your expert as and when required to ensure you're getting your requisite treatment. The second do I would say is that if your expert is suggesting that medication is the right route, don't go on to Dr. Google and start figuring out what could be or what could not be, right? Instead, follow the advice that is given. The third thing you must do is the questions that you're thinking of looking for on Google, instead put them towards your expert, right? We're all trained people. We will be happy to answer questions. There is no doctor who does not want to answer any question, right? We would rather have people come to us, share their apprehensions about any aspect relating to the treatment, and to come and ask us instead. The fourth thing, which is an absolute must, is it is very important to, as far as possible, follow routines. They can be a real struggle, especially when someone is struggling with coping with a mental health related problem. But as far as possible, if you can integrate some things into your routine, even if it's very minimal, even if it's just 2 things or 3 things that you're doing regularly every day without fail, it would certainly be very, very helpful. And the last thing, the 5th thing, I think, is that you must talk. You must choose to share your feelings, your thoughts. You have to unmute yourself. Forget about what people will think. Forget about whether someone is understanding or not. Be willing to share and express. You will find someone who's there to support you during this time. I think that's very important. So those are my 5 do's for you if you are someone who is struggling to cope with the mental health problem. If you are someone who's a caregiver and who's trying to support an individual struggling with a mental health related illness, then there are 5 things which I would suggest you should absolutely steer away from. The first is that avoid being critical. Oftentimes what we don't realize is that because we believe that a task is very simple, we become very pushy and nagging. We don't realize that we may become critical and berating, and that certainly tends to affect the individual's mental health related concern. The second thing which I would suggest in this situation is that you must avoid making any comparisons to your own self or to any other person. It's not a competition. If someone is struggling, do not compare them to anyone else in terms of their experience or what they can or cannot do. The third very important thing is never say that I know how it feels, because you can never know what it feels. Even I, as an expert, cannot know what it feels like unless I have gone through that illness. I can empathize, right? I can try and understand what the experience is like and how much it would be affecting the various aspects of an individual's life. But I will never know the effect it is having on an individual internally. So that is something which is very important, because we automatically end up saying a lot of these things without really realizing what it may create in another person's mind, because they would feel that you're just trying to dismiss the conversation, and that's not helpful. The fourth thing is that it's absolutely important that you do not blame them for whatever is happening in their life. So do not try to find what is the reason that they may have ended up landing up with a mental health illness, right? You have to approach it from the perspective that we have a problem, we need to address it, we need to ensure that, we're taking care of things. Nothing else is more important at this point in time. And the fifth aspect is that we must ensure that you are not utilizing any other person's example to say that, if this person can do this, so must you be able to do it. That is not going to be helpful at all. You do not utilize another person's example to say, if this person did not require medications, why do you? They have been through the same situations, why are you going through this? These five things, I think, are very, very important, which must be kept in mind. And if you can remember these, the person around you who's struggling with a mental health problem will not hesitate to reach out and seek support at any point in time.
Kamna, that's an amazing list. And my favorite is to unmute yourself. And I have to say that as someone who struggles with acute anxiety, I have survived because I have a mental health friend, and I can just pick up my phone and talk to her and vent, and I do the same for her.
Right.
We are ready to wrap up. I'm to ask my last question to you. There's been this acute awareness around mental health during the pandemic, during the lockdown as well. So how does one sustain it? What are the learnings? How does one ensure that you don't forget about it once COVID-19 is all over and you've moved on with your lives?
I think the best way to do that is to also realize that COVID-19 has come along with a lot of other concerns also. We've been in the midst of earthquakes, we've seen cyclones, we've seen locust attacks, we have seen, issues happening on our borders, right? And the fact is that mental health concerns will keep on coming up regardless of what time period we're going to be in. Because till the time that we're all humans who have thoughts and emotions, there is no way that your mental health is not going to be of significance. And if any individual wants to do well, wants to be productive, wants to live a good life, then focusing on mental health is very important. And it is up to each and every one of us, regardless of whether we are surrounded by mental health concerns or not, or with others who have mental health concerns or not. It is each of our responsibility to keep the narrative going. We have to keep talking about it. We need to ensure it stays in media. We need to ensure that there is more and more information that is being passed along. There needs to be an impetus towards looking at public-private partnerships. We have to keep on looking at filling the gaps that I was talking about previously. We need to look at more training mechanisms, getting in we won't have experts very soon, but we can look at training individuals who are working in, say, schools. The teachers, they already do such a good job, but they can certainly, develop more skills. Parents can develop more skills to be able to work with their children. We can work with general practitioners. We can work with Anganwadi workers. And these are all ideas that we all need to push for. And if there is a pressure coming from all of us, as the public, as the consumers, a lot of these things can get easily implemented. So the onus is on each one of us. If you can feel the relevance today, don't forget there will be more situations coming up in the future where you will need to look at this yet again. So we need to utilize this as a push towards ensuring that we make mental health a priority for each and everyone now.
Very well put, Kamna. With that, we come to a close. Thank you so much. It has been a real joy listening to you talk. And thank you to all our viewers for joining us for this discussion. Follow Rolly Books on YouTube, Facebook, Twitter, and Instagram for more updates. And do check out healthcollective.in to know more about the work they do. Thank you.